Every deep drawn breath is about telling the story of real people and real research, medical history, and the personal aspects of these people's lives, bringing together this technology and touch so that they can figure out a way forward. You're going to meet some patients of mine today, Sarah Beth, Lovemore, and Titus, who was cared for at the Children's Hospital, and his mother, Alison. Sarah Beth was a patient in the early 2000s who got the old way of ICU care before we had the ABCDEF bundle.
A friend of mine took me to the emergency room on Memorial Day night where they admitted me, then spent 33 days on a ventilator. Both my kidneys failed and I went on dialysis. My memories of that time being sedated are like living in a Stephen King novel. It was nightmare after nightmare after nightmare.
Medicine had to adapt over time so that we could do a better job. If you contrast her story with that of Lovemore, who's taken care of with the new way, you're going to hear him describe early on being mobilized, awake in the ICU. And that's also the way that Titus, a 4-year-old with sepsis, was cared for.
On Valentine's Day of 2018, I was outside the library in Green Hills and I got mugged and I got shot in the stomach. They were worried about whether I'd be able to walk again. So getting me off my feet during the first week that I was in the ICU was really good.
One thing that really surprised us is, and it was a brand new protocol at that time, is getting them moving as quickly as possible. Everything improved from there.
I am proud of the fact that something that happened to me improved someone else's life when they go through an illness like that.
Finding the joy and not letting what happened ruin our lives.